Aloha everybody, welcome to our first online segment of our online communication tool here for the Arcadia Family of Companies. Our first segment that we're doing is to talk about the rapidly spreading COVID-19 pandemic and what the Family of Companies is doing to protect all of you, our precious employees. With me today, I'm sitting with two individuals who I'm sure you recognize. We have Albert Torres, our Director of Safety and Facilities Management, as well as Anna Gelino, our infection preventionist for the Family of Companies. They're joining me today to talk about COVID-19 and what the Family of Companies is doing in order to protect the safety and health of all of you. So welcome to both of you.
Thank you, Susie.
Great. So I have a couple of things that I'd like for each of you to touch upon. So Anna, why don't you talk to us about why it's important not to come to work if you're sick?
Thank you. We need your help to make sure that we're not bringing this COVID-19 virus into our communities. So we're asking that any employee stay home if you're not feeling well. If you're having any symptoms like fever, cough, shortness of breath, or sore throat, please do not come to work, but call into your supervisor and let them know what's happening. And not just if you yourself are feeling ill, also if someone that you reside with, if a family member who lives with you is also having similar symptoms, cough, shortness of breath, fever, sore throat, we're also asking that you not come to work at that time.
Thank you, Anna. Albert, share with us about PPE.
Yes. One of the ways that we can prevent the spread of any infectious disease is the proper usage of our personal protective equipment, PPE. We do know that there's a shortage of PPE across the country. And so what we're doing is to make sure that we have a plentiful supply is continuously monitoring our inventories. Not only that is we are staying in constant contact with our vendors and suppliers to make sure there is no shortages. In the event we do have a critical shortage in PPE, we have folks in the community that we can reach out to, such as Hawaii Healthcare Emergency Management, HHEM, and they will help facilitate the delivery and disbursement of PPE to us. Now, in the event you do have any questions on when to properly wear your PPE, please just contact your supervisor, manager, or NIG.
Thank you, Albert. So we have a few questions that have come in, and we would like to ask them right now to the experts. So Anna, the first question is for you. What is the risk of me getting COVID-19 and spreading it to my family?
Unfortunately, right now, with the situation, the way it is in the world, within the nation, there is a risk that staff may become sick with this virus. Whether you pick it up in the community or whether it's something that we'll be dealing with here at work, we want to make sure that we're putting in all the measures to prevent that from happening. We don't want you getting sick and bringing it home to your family. So the most important thing that we can do is to ensure that we're following our infection prevention procedures. Ensure that you're practicing excellent hand hygiene while at work. Use the alcohol-based hand rub or soap and water whenever indicated. Make sure that you're using your PPE in the way that you've been trained, and if you have any questions, please reach out and let me know, your supervisor knows, so that we can make sure that you know how to use it properly. Another thing that I've noticed lately is that some nurses or other staff members might not be having their hair put up, and that's one thing that we can do with an easy fix. If you have your hair secured properly, it's not going to be getting any germs, and also your hands will be kept away from your face at that time. And then one very important thing is that when you're going home from work, please make sure that you're changing your clothes, your work clothes, right away when you get home, and also making sure you wash your hands as soon as you get home.
Great. Thank you, Anna. Albert, are residents involved in our efforts to protect our communities? What are they doing?
Well, yes, they are. Not only are they helping to expedite some of our food deliveries, but there are several residents at Arcadia and at 15 Craigside that are fabricating reusable masks. And so they started that this last week, and hopefully next week they'll have some in production that we'll be able to distribute to most of our staff.
Great. Exciting. Okay, Anna, who should be wearing gloves and when? What we're hearing from staff is that employees are wearing the gloves to keep extra safe.
It's wonderful that our staff are trying to do extra measures to keep us all safe now. But that is something we've noticed lately, is that people are wearing gloves during their day-to-day activities when they would not normally be wearing gloves. So I'm just asking that You don't wear gloves unless it's really indicated by your line of work. So if you're going to be coming into close contact with the potential for coming into contact with blood or body fluids, that is a time to be wearing gloves. Also, if you're coming into contact with chemicals, if you're doing chemical cleaning, that's another time to wear gloves. But it's not a good idea to just be wearing gloves around during your day-to-day work or all day long, because the gloves are still going to be able to transfer germs from surface to surface. People may not wash their hands all the times they should be if they're wearing gloves. Also, wearing gloves for long periods of time can actually create a good environment for germs to grow, and we don't want that.
Thank you, Anna. Well, that concludes wrapping up our first segment. Much thanks to Albert and Anna for joining us. Just some closing comments is that, as you all know, we're in an unprecedented time. And I, along with many of my coworkers, continue to witness so many examples of all of you stepping up, stepping out of your comfort zones in order to answer the call of duty at 15 Craigside, at Arcadia Home Health Services, at Central Union Adult Daycare, even though it's closed, as well as Arcadia at Home. There has been no questioning, there has been no complaining, and there's been no hesitancy in you folks stepping up to get the job done for our residents, our clients, and our members, and our fellow employees. And amidst this awful pandemic, a shining beacon is truly the amazing human beings, all of you, who are committed to working together in order to improve the lives of those that we serve. We thank you very much for joining us for this segment. What we'd like to ask is that since this is our first segment, please think about a name to call this show, if you will. And if you have any suggestions, please feel free to email myself or email your supervisor to share what you think it should be called. Thanks again, stay safe and stay healthy, and we'll see you next week.